And your entire approach of healthy eating was so refreshing for me because you're the first person who told me not to count calories. But when you look at all these influencers, people who don't have a background of prescribing or helping people with all of this, and they come up with something that says, do this, do that, lose weight in 7 days, do the keto diet, paleo diet. How does it make you feel?
So, look, I have to thank the fact that the conversation is getting started. Maybe 10 years ago, so I started, actually, this is a funny story. 2014, when I started talking about diabetes reversal, I got scolded. I got pulled up saying, don't say this. And literally, the sentence told to me was, what if a patient hears you talk about diabetes reversal and goes and eats so many mangoes and then their glucose becomes 300? That'll be a case for us. So don't talk like this. 2014, I had given a lecture and the circular was distributed that this is the topic, come for this educational event. And I was scolded for it 10 years ago, 11 years ago.
Okay.
So that's how lonely the space was back then, that it was, I was being pulled down for saying it and told not to say. So I'm thankful that in the last 10 years, people are talking about diabetes reversal now. Now you see so many startups in the space. Are they all doing it the way I think? But they should not, they're not obliged to. Let them do it their way. At least they're raising awareness. At least there are people in the industry talking about it and telling patients that reversal is possible. Right? Now, the customer or the patient has a chance to be more informed. Oh, there is an alternative narrative that's possible. Should I judge? No, I don't want to judge. Now, they might be believing in what they're saying, so they're saying. I'm sure they're not trying to harm the patient. Nobody's evil that way, right? So, why should I contaminate my real estate with getting into the judge space? But if a question comes, what is right, what is not right, we have to answer it according to what we've done our reading. So, it's okay. Let the conversation continue.
Have you ever seen a case where someone's spiritual growth triggered physical healing without a single prescription?
My own case, for sure. I am a Hashimoto's hypothyroidism case. So, the most common cause of hypothyroidism is autoimmune, where your own immune system is attacking your own thyroid gland. And so, there's an antibody for that, which mine is positive. So, if you do the blood test, you'll see that my immune system is trying to or is capable of attacking my thyroid gland. So, I was on thyroid medication. And after, this sounds weird to say it on internet, but yeah, the only thing I did was learn stress management through Reiki and meditation practice. And now it's more than a decade. I've not needed a thyroid pill. So, is the antibody gone? No. But do I need medicine anymore? No. My blood tests are fine without the medicine. But we are told and trained, once you take this thyroid pill, you're on it for life.
It's not true.
I'm alive. Nothing happened by stopping a pill. So yes, people's learning to manage stress. I've seen people's allergies go away, food intolerances, people who would break out in hives, gone once they did hypnotherapy and they realized there was some emotional block somewhere that was coming out into the skin. Migraines getting better. So what, some doctors, we were trained to call it psychosomatic.
Yes.
Now that word is a bit difficult. I don't want to use that word, but maybe a tongue twister word: psycho, neuro, immuno, endocrinology.
Psycho, neuro, immuno-endocrinology. Okay.
You're smart, so you're keeping up. Psychology,
Okay.
thoughts,
Okay.
neurology, how they affect the brain. So
Okay.
your thoughts are going to fire through your brain neurons.
Okay.
Immune system,
Okay.
immunology, endocrinology.
Okay.
So people having allergic reactions, people having hormone responses to negative thoughts, it's all connected.
Yeah.
It's all connected. Thoughts, feelings, emotions, hormones, gut responses. We say, na, trust your gut.
Yes.
I feel it in my gut. Gut, brain. So how is that happening? The brain is up here. My gut is over here. How are they connected? My brain is not connected to my intestine, but it is through nerve connections, through hormone connections. Everything is talking. How come we feel anxious in the stomach
Yes.
when we go for something? My stomach is just feeling, so there is a communication going on.
Yeah.
So it is connected. And yes, being aware, mind affects body, body affects mind. So many instances. And that's why we keep a spiritual therapist in our practice for those who are open to it. They don't have to do a session, but if they want, if they're with us for, let's say, 3 months, if it comes up in conversation that, this event, I'm stressed, I'm negative, it's bothering me, or I can't understand why I keep doing the same habit which is not helping me, do you want a session? And then they'll realize something. Could be some childhood issue, could be some other life experience, negative experience, and they weren't aware consciously now as adult what was the issue.
It's so interesting. I mean, I believe in this 100%, and to be hearing this from a doctor is actually so reassuring for me also.
That's what. So forget that I have a degree, right? If I was just a human being,
Yeah.
then we were okay that
Yeah.
she's saying something that.
Oh, yeah. That's true. And why do you think it's easier for people to follow strict diets than to sit with the discomfort or face what's underneath?
Oh, yeah, that's a good question. And I have to be very blunt about that with
Yes.
people, is because patients will be like, sometimes they'll call, can you give me a sample diet chart? What's the sample diet chart that she's going to give? We don't give any diet charts. We're not going to tell you what to eat. Now, why are they uncomfortable with that? And I did an Instagram post on this. Obviously, it's not doing well because I don't know how to promote things on social media. But I said there that the reason people want diet charts is they want to be told what to do. It keeps me out of decision making. I'm off the hook. It's a cognitive load which you have taken away. I don't want to think about what I should eat. You tell me what I should eat. But for me, that's exactly the opposite of what I'm trying to do with you. I'm trying to awaken your wisdom, awaken your self care, give you the knowledge which is clearly lacking because you're not getting the results which you want. I would be fooling myself if I give you a diet chart and say, Gayatri, live like this now, okay? Eat only from this paper. When tomorrow, when there's a rainstorm and there's a wedding and there's this problem in your office, doesn't matter. You have to eat only from this paper. So then again, you'll be off the hook. And then what will be the logic? I fell off the wagon. Where's the wagon? I fell off track. Where do you see a track anywhere? Right? These are all words. These are all just games. So the mind is escaping. Yo, on the diet, off the diet.
Yes.
So there's a mindfulness which I'm trying to help you bring, whereas being on a diet makes you mindless. So I learned this in a course in 2014 by a doctor who had struggled with dieting her whole life, trying to lose weight. And she was like, I'm a doctor. Why am I not able to figure out my own body? Like, what's happening? And she realized that years of dieting, the yo-yo concept is you're either dieting or you're overeating.
Yes.
There's nothing in between.
Yes.
Okay. So the yo-yo we say, right? So she's like, a yo-yo can either be at the top spot or at the bottom. There's no halfway point where a yo-yo can rest. Yo-yo up is dieting, strict, not listening to myself, ignoring my needs, listening to some piece of paper. Overeating is fully listening to what I want, not thinking about health, right? Two extremes. She said, what if instead of a yo-yo model, we switch it to a pendulum model? Where instead of I'll only eat for pleasure or I'll only eat for health, instead of being so extreme, can I come in the middle where I know how to balance eating for pleasure and eating for health? Then the amount of changes required are not drastic. And it is possible to live somewhere here where I'm in a balance. I'm not restricted. I'm not polar and this on diet, off diet. But that means now it's me in charge. Right? So she's like, she made a list and I found it helpful ever since. And this was never taught to me in my medical training, but it was a vocabulary I needed. Was the dieting language: cheating, indulgence, a treat meal, what was the thing she said is in control. I need to be in control of what I eat. I can't control myself. She said, what if you say I'm in charge?
Yeah.
Right? So how do people respond to this? Again, in India, sometimes the culture is such, right? One is they get shocked that, oh, the doctor is giving me decision making rather than doctor deciding what should happen to me. But also this is that, oh my God, you're making me accountable. That if I do it, it's me. If I don't do it, it's me.
Yeah. I think a lot of us just don't want that accountability, right?
It's uncomfortable.
Yeah, it is uncomfortable because it does not go the way I want it to go. It's still me. So I might as well put that blame on somebody else.
Exactly.
And it comes because of habit also. We've been habituated to blaming anything and everything on the outside rather than sitting down and telling ourselves, dude, I am 100% responsible for every single thing that's happened to me in my life.
Exactly. So patients will sometimes tell me, "Hey doc, I'll see you after New Year's. I'll or something. Like I have some patients in the US. They'll say, I'm going to India, and I physically and the doctor is in India, right? I'm going to India, so I'll talk to you once I'm back in US. Okay, why? I won't be able to manage while I'm there. So I'm like, but you're bringing diabetes along with you, right?
Yeah.
Diabetes is coming with you. So there, it's like this mind just doesn't feel like. So we actually have to show them that looks like you feel that you can either travel or you can manage health. You feel you can't manage both.
Both. Okay.
So that habit, we're breaking that habit because all the previous holidays, they would go. And so some people will say, I gain weight on every holiday.
Mm.
Now that I'm back, New Year's resolution or etc. etc. Now I'll buck up. I'm on track now. So the reflection there is, it's a reflective listening style. So you feel like you can either manage your vacations or you can manage your health. You can't manage both. That's how you feel right now. And they've never heard that
Yes.
played
Yes.
back, right? So we are all reaffirming this black and white thinking, all or none thinking. We're not allowing people to come into that middle ground where it's messy.
And if you had the opportunity to redesign how India educates children about sugar and health, where would you start?
In the home,
Mm-hmm.
sometimes it comes on the woman of the house, and I don't think that's right. It needs to be a shared responsibility amongst all the adults. And there's a beautiful book on this by Ellen Satter, and she says that as the child grows, there is division of responsibility. Beautiful. She says when the child is very small, the parent decides what to eat. The parent decides when the family eats. The parent decides where the family sits to eat. The parent makes the eating environment pleasant. This is the job of the parent. How much will be eaten is in the hands of the newborn, is in the hands of the toddler, because baby is not hungry. Baby might not be hungry. So the problem in India is, oh, baby didn't eat much at lunch. So when the child gets down from the lunch table, 2 hours later, the parent is running behind the bacha with some snack or some tiffin and chasing them around, make them watch some digital screen and try and poke the food in. You're creating a mindless eater by doing that. You're not setting a body awareness of I'm hungry or not hungry. So as the child gets older, the child will always be in charge of how much they eat because they know about hunger. So one of the biggest things I always tell my kids and parents who ask about kids, only your child will know how much they can take at a time. So we have to trust and we have to communicate. The problem comes when parents will give this voice, you're not eating enough. Until you eat 2 servings of roti or rice, I'm not letting you get up. Until you eat this much of broccoli, I'm not giving you dessert. I'm training the kid to not listen to hunger. As though parent knows more about portion size than child.